Hello, everybody. We are marking Eating Disorders Awareness Week. And today with us is our counselor, Corporate Counselling Services counselor, expert from Italy, Elisabetta Maglio. She is specializing in eating disorders. Welcome, Elisabetta. Could you please introduce yourself?
Hello, hi everyone. My name is Elisabetta. I'm originally from Italy and I'm actually live in Milan at the moment. I'm a psychologist and mental health counselor, cooperating with CCS for quite a while. And today I'm here to talk with you about eating disorder, which is a very common and spread disorder around the worldwide population. I, concerning my expertise, I work with many clients affected by eating disorder. As you all know, we tend to think about this range of disorder has something that affect young population, but actually overall it's becoming more and more frequent also in all kind of adults, even older adults. We know it has women disorder affect more female population, but actually it's becoming more and more aware, more spread also across the male population. So I think it's a very close matter to my heart as well, and I think that it's very good to spend some time in raising our awareness on how to be more knowledgeable about the situation.
Thank you, Elisabetta. When we think about eating disorder, is a deeply personal issue, perhaps. What do you think should actually workplaces and managers actually consider about eating disorder? What kind of impact it could have on a workplace? Perhaps you could let us know some example that have been in your practice.
Exactly. I think that it would be very relevant for us to start it with a case that came to my mind that I've been in touch with a few months back. I received, as a CCS counselor, a request from someone here in Italy who was seeking assistance because one of her colleague and friends, as a consequences of a very severe eating disorder, had recently died. My client at the time was utterly shaken because she herself had an history of eating disorder. So it was not just a personal grief as a friend, but it touches something deeper inside as a person. And she was seen all over the workplace and her personal life, a lot of potential triggers. She recognized most of the signs that are relevant in an eating disorder that can be concern about weight and body appearance, a diffuse sense of fatigue, constant comment about being fat, constant preoccupation about food. But what she was referring as very personal was all the impact that it was having also on her life as a social being insert in a community. And that's what she saw as well in her colleague and friend. So constant mood swings, very frequent anger outbursts that affected the daily life of the whole office. The difficulties also in focusing and performing at a level that was requested by the company. So I remember how she was telling me with a sense also of shame and guilt that she's like, I tried to do whatever I could to cover up for my friend because the level of his output in the office was not as it used to be before the eating disorder was at its peak. So with all these elements she came with a very heavy heart, also because it triggered a lot of feelings inside of her. And also like she felt like she was telling me like, I'm not sure whether we did all it was in our possibility to help this person. So that was something that immediately came to mind when we started thinking about eating disorder and how it impact the workplace and colleague, but also on a managerial level, what can we do? I guess this is a good question as well.
Yes, indeed. Thank you very much for this case. Indeed, what can be done on a company level to make sure that there is kind of support at the back end for such cases, which, like we said in the beginning, are deeply personal, but actually have a direct impact on the workplace situation? What can be done?
Well, I think that it's important to start raising our awareness on what are the potential red flags that we can look out for in the workplace. If we think that someone around us might be affected with an eating disorder, and because as you know, it's a very personal area. It's covered by privacy, and of course, a workplace is not like a medical center where you can just address the issue, right? There is confidentiality, there is a lot of area that we need to be very sensitive about. So before tackle the question of what can we do, I just want to spend a minute with you here, try to understand what are the red flag and warning sign that we can pay attention to. As I was saying, like fatigue and low productivity can be the initial thing that we want to pay attention to. Something like, as I was saying, emotional outburst, someone that is always on edge, someone that is constantly preoccupied and constantly looking out for, feeling like it's been judged, it's been looked at, it's been singled out from the rest of the group. A colleague that all of a sudden start refusing to join. And I know that has a lot to do with Italian culture, where we always have coffee breaks and stuff, but a colleague that all of a sudden start refusing constantly to eat together, to attend in meal, or to attend a gathering, office gathering that revolve around food, like dinner out or any sort of other seminar that can be in person that involve food as well. Someone that is keenly preoccupied about excessive workout. In terms of manager, I think that is slightly different as well, because we have people that are required by the job description to also judge the outcome of an employee. So, for example, looking for someone who is struggling to focus in, someone who's deliver like output that are less detailed and precise than before. Someone that is struggling, for example, also to be present during meeting, or someone who has increased a number of sick leave. Something that it's very peculiar for this disorder is the level of absenteeism. So, of like days that people are often work without a prior request, or on the other hand, a very frequent presenteeism. So people that stay in the office for very long hour because based on this very specific condition, they increase the level of perfectionism. But as we said, it's like the ability to focus and concentrate and perform as before can affect their expectation of their outcome. So those are overall the warning sign that we want to look out when we are
Right.
considering
Right.
workplace.
So I just imagine myself, for example, I'm an HR manager or I'm a line manager, and I see the signs. So what do I do? How do I approach this subject with this particular person? What are the practical next steps for me?
Well, first, as we said it before, it's a very sensitive topic. So something that I will more comfortable feel like should be tackled by professional expert. So I guess that the first thing that a manager can do in the workplace and work environment is try to create an environment that is accepting and more supportive, and maybe more flexible in terms of timing, or open to accept requests, specific requests from the employees. And this is like first aid tools. Other than that, and it's a rule of the thumb, something very general we can apply. But if we really have a concern that we might face something deeper and more serious, I guess that the best resource is to try to reach out and invite gently, or at least talk about the possibility for all our employees to refer to an employee assistance program where the person can be in touch with a professional that can have structured assessment of the situation and can try to provide first aid. We call it first aid kit, something that can help in the moment in order to overcome a situation, or can have a very professional evaluation of what's going on and what would be the best solution at hand.
Thank you, Elisabetta. Indeed, Employee Assistance Program is one of the main services that Corporate Counselling Services provides as a company. And obviously, on the topic of eating disorders, we have more content for you to look at. We have a specific blog published on our website. So please come to ccsint.com. You can also follow our page on LinkedIn, and we remain for your further questions and any kind of comments that you might have. Thank you very much for your time today, Elisabetta, and have a good day.
Thank you, Nadia. Thank you, everyone, for listening.